Chronic enteropathy, or C as it's often called, represents a group of diseases with origins that are not fully understood, contributing to the majority of cases where dogs present with chronic diarrhea. Veterinary professionals classify these cases based on how they respond to specific treatments. You might hear them referred to as food-responsive enteropathy, microbiome-related modulation-responsive enteropathy, immunomodulator-responsive enteropathy, or non-responsive enteropathy, depending on their response to a stepwise approach to therapy. These conditions can significantly impact a dog's health, leading to symptoms like diarrhea, vomiting, reduced appetite, and weight loss. Because the exact cause is often unclear, involving factors like genetics, immune responses, environmental influences, and disruptions in the gut microbiota balance, finding effective treatments is crucial. Our first source for today explores the impact of diet, a critical component of managing these cases, particularly focusing on hydrolyzed protein diets, which are commonly used as a first step for dogs newly diagnosed with chronic enteropathy.
Absolutely, and diet plays a pivotal role in how we approach these conditions. The first study we're discussing today specifically aimed to understand how dogs with naive chronic enteropathy, meaning they hadn't previously tried a hydrolyzed diet, responded when transitioned to one. It also looked at the benefit of trying another diet in dogs already classified as non-responsive to initial treatments. This was a retrospective, multi-center study, reviewing medical records from 3 referral centers in Europe over several years. They included dogs diagnosed with chronic enteropathy, who had chronic diarrhea for at least 3 weeks, often with other signs like vomiting or changes in stool appearance. Important, they excluded extraintestinal diseases and infectious causes. They reviewed data on things like diet history, clinical signs, treatments, and how well the dogs responded after about 4 weeks. Clinical response was assessed using either a stool consistency score or the Canine Inflammatory Bowel Disease Activity Index score, depending on the group. For the naive chronic enteropathy cases, the transition was specifically to a hydrolyzed diet. These diets varied, with the majority being soy-based and a smaller number being chicken-based hydrolyzed formulas. The statistical analysis used methods like descriptive statistics and specific tests to compare scores before and after the dietary changes.
And the results for that first group, the naive chronic enteropathy cases, were quite telling regarding the importance of diet. The study found that in about 20% of these dogs, simply changing the diet was the only therapeutic intervention made. Within this specific subset of cases where diet was the sole change, a remarkable 88% of the dogs showed a decrease in their stool consistency score. The median stool consistency score for this group, which started at a median of 2, decreased to a median of 0.5 after the dietary change, showing a statistically significant improvement. If you're enjoying this, remember to like, share, and subscribe, as proceeds from this channel go directly to providing vital veterinary care for animals in need.